She kept feeling dizzy for months. Every doctor checked her ears. The real cause was hiding in her neck the whole time.
It's called DISH, a bone-hardening condition in the spine. Today we uncover its real, science-backed link to vertigo and diabetes. By the end of this video, you'll understand exactly how cervical DISH, forward head posture, and dizziness are clinically connected. DISH, Diffuse Idiopathic Skeletal Hyperostosis, causes ligaments along the spine to slowly calcify and harden into solid bone. First described by French physician Jacques Forestier, this condition was originally known as Forestier disease before being renamed DISH. DIH most often develops in the thoracic spine, but when it reaches the neck, it can quietly reshape how the cervical spine moves. Here's what most people don't know. DISH is strongly linked to type 2 diabetes, insulin resistance, and a metabolic syndrome. Research shows elevated insulin levels stimulate bone-forming cells, driving the excess calcification seen throughout the DISH-affected spine. Large studies show DISH is significantly more common in people with diabetes, obesity, and prediabetes than in the general population. In the cervical spine, these bony bridges form directly in front of the vertebrae, sometimes pressing against nearby throat structures. This bony overgrowth can compress the esophagus, causing difficulty swallowing, hoarseness, and in rare cases, breathing discomfort. Fused segments in the neck sharply reduce flexibility, making it harder to extend or rotate the head through a full range. As the front of the neck stiffens and loses extension, the head is gradually pulled forward into a fixed, rounded posture. Clinically, this is measured using the craniovertebral angle. The smaller the angle, the more forward the head has drifted.
This forward shift places constant strain on the small suboccipital muscles at the base of the skull, muscles rich in sensory receptors.
This forward shift places constant strain on the small suboccipital muscles at the base of the skull, muscles rich in sensory receptors. When these receptors are compressed or under chronic strain, they send distorted signals about head and neck position to the brain. Your sense of balance relies on three systems agreeing: your eyes, your inner ear, and your neck. Cervical dysfunction breaks that agreement. When neck signals don't match what the eyes and inner ear report, the brain interprets that mismatch as dizziness or unsteadiness. This isn't the room-spinning vertigo of inner ear disorders. Cervicoganic dizziness feels more like unsteadiness, imbalance, or lightheadedness. Symptoms are often triggered or worsened specifically by neck movement, prolonged postures, or turning the head quickly. It often travels with neck pain, headaches, ear fullness, or ringing, a cluster of symptoms tied directly to the neck.
My neck is so stiff, and my balance is getting worse.
Any inner ear problems?
No, they said my ears are fine.
This fits a very recognizable clinical pattern. Clinically, it presents as dizziness tied to neck position or movement, alongside stiffness, reduced range of motion, and normal ear testing.
Diagnosis starts by ruling out true vestibular disorders, then carefully assessing cervical mobility, posture, and reproducible symptom triggers. Slowly turn your head to the right. Any pain or dizziness?
A little stiffness. Imaging confirms DISH using established radiographic criteria, identifying continuous flowing calcification across at least 4 vertebral segments. Because of its strong metabolic link, finding DISH on imaging is a reason to screen for diabetes, even without other symptoms.
Targeted physical therapy retrains cervical proprioception, helping the brain reconcile signals from the neck, eyes, and inner ear. Good. Now slowly turn your head to the right.
Postural correction exercises like chin tucks help restore head alignment and gradually reduce strain on the cervical structures.
Managing blood sugar and insulin resistance may also help slow further calcification, addressing the condition at its metabolic root. Dr. Jacques Forestier first described this bone-hardening spinal condition in the 1950s, giving clinicians its earliest recognized name. Radiologist Dr. Donald Resnick later established the diagnostic criteria still used today to confirm DISH on spinal imaging. Today you learned how cervical DISH can drive forward head posture, disrupt neck proprioception, and trigger real, clinically recognized dizziness. If this helped connect the dots for you, subscribe to Diabetes 2 Reversals for more science-based health content every week.